Hello friends, welcome back to the channel and another video. My name is Dr. Caroline, a practicing board-certified family medicine physician, and in today's video I want to share my thoughts on two different physician compensation models, the RVU versus the salary compensation models. Both of these are widely used in the healthcare system and we're going to see which one is best. Now I will go ahead and say that it's really going to be up to the physician which compensation model they prefer. It's not one model fits all. I practice in an RVU-based system and personally that is my preference. The RVU compensation model is essentially a productivity type model. RVU stands for relative value unit, and RVUs are a metric used to measure provider productivity and ultimately determine compensation. So you can think of it as earning a commission for the work that you do or for the additional work that you do. So there is obviously an incentive to do more, see more patients, manage more complex cases, do more procedures, etc. So the more work that you do, you increase your potential to earn more. Now, as you can imagine, this may bring on more stress. I've talked about my burnout story and how I've been able to recover from that and how I've been able to learn how to practice better, maximize my productivity, and how I've really been able to scale my income without risking burnout again. And I actually have an entire program on this teaching primary care physicians how they can do the same. So check out the link below if you're interested in learning more. On the other side, in a salary compensation model, the physician just earns a straight salary. There is no commission for doing more work, so there's really not an incentive to do more. So as you can imagine, there's going to be an earning cap with this type of compensation model. So as I mentioned in the beginning, as far as which compensation model is best is really going to be up to each physician. If you want to have the ability to earn more, then the RVU model may be for you. Now, a couple of things to note. Number one, there are some RVU contracts where if you don't meet your RVU threshold, your base pay will be cut. So this is an example where the unpredictability of your pay comes in with regards to the RVU model. So you want to be aware of that. The other thing you want to be aware of with your RVU contract is if there is a tiered program. So essentially with each threshold that you meet or surpass, your pay per RVU goes up, which is fantastic. So again, not every RVU contract or employer has this type of program, but if yours does, that is amazing because it definitely helps to maximize your pay. Now, on the other side, if you don't want the stress of having to do more and you just want a predictable salary, then the salary compensation model may be for you. Now, one last thing I want to point out is just because you practice in an RVU-based system does not mean that you need to feel pressured to do more work. There are definitely providers that will work just enough to make a comfortable income for themselves and never feel the pressure to necessarily do more or earn more. So I hope this video was interesting to you, and if you've ever had that question in your mind as far as which compensation model is better as far as the two that we discussed in this video, then I hope this video was able to shed some light. If you liked this video and you enjoy this type of content, then definitely make sure to subscribe because I do post a video like this every single week. Again, check out the link to our RVU consulting program if you're interested in learning how you can seriously maximize productivity and scale your income while decreasing the risk of burnout. Thank you so much for watching. Make sure to leave a like and share this video with your colleagues. I'll see you next time.